Welcome to the Birds and the Bees podcast. This is Braxton Judson.
That's the key. People aren't talking about it.
Everybody needs to know that porn is not a documentary.
It's not like if we don't talk to kids about sex and sexuality, they're not going to hear about it. They're just not going to hear about it from us.
They have tons of questions, they just don't know how to ask them.
All you have to do is be one chapter ahead. You don't have to know everything. Just one chapter ahead of wherever your child is.
A fear many men have is the thought or experience of losing an erection. This fear can be from a lived experience, concern for the future, and the worry of what their partner will think. Hey everybody, this is Braxton Judson. Welcome back to Birds and Bees podcast. I'm so glad to be with you hive mates once again. If this is your first time, welcome to the show. If you're a longtime listener, thank you for your continued support. Now I could talk about how many social misconceptions there are about the penis and how erections tend to be seen as the end-all be-all of sexual functioning. However, today I have Dr. Judson Brandeis with me to talk about preventing erectile dysfunction and managing it if you experience it already. He even has some options of joining cutting-edge research that could help you with your erectile dysfunction. Dr. Judson Brandeis is a board-certified urologist with expertise in sexual medicine for men. He's the director of clinical excellence for GAINSWave and created their online male sexual medicine curriculum. Dr. Brandeis is also the lead instructor for the in-person male sexual medicine course, which includes GAINSWave, shock therapy, and PRP injections. Brandeis, MD, is located in the San Francisco Bay Area, specializing in GAINSWave for ED, Peyronie's disease, penile augmentation, and other medical and surgical procedures that improve sexual function for men. Dr. Brandeis is going to give us 5 things today that every male-bodied person can do to help prevent and treat erectile dysfunction, address the 3 pillars of manhood, and invite you to participate in cutting-edge research to continue improving how we treat erectile dysfunctions. The discussions that we're talking about today tend to be extremely private for a lot of men, and this information needs to get out there. So I encourage you to send it out and share it with anyone and everyone, because these conversations are so important to have. I'm excited to get to the episode here, but before we do, I am real excited as well because so many individuals have talked to me and said, hey, I want you to make a course about how to talk to your kids about pornography and what to do when you find out when your kids have looked at pornography. Well, I've got good news for you. I just released 2 e-courses on pornography, parenting, and conversations with your children. The other one that I created was Help. I caught my children looking at porn, and now what? To go check out these courses, go to birdsandbeespodcast.com. I have a link on the front page you can follow to get these courses. And I'd love to hear how it helps you in starting these conversations and addressing pornography with how it shows up for your kids. If you have any questions, please feel free to leave me a voicemail or text me at 385-449-1818. You can also email me at birdsandbeespodcast.com. Again, thank you so much for listening. I appreciate all of you hive mates being here to support Birds and Bees podcast. Let's get to the episode with Dr. Judson Brandeis. Hey everybody, welcome to Birds and Bees podcast. This is Braxton Judson, and today I'm real excited to bring you information about erectile dysfunction. And today I've got on the show Dr. Judson Brandeis. And I'm real excited to have you on the show today, Judson. Thanks for being here.
Oh, I'm really happy to be here too. Thank you for inviting me.
We got in contact via email, and actually me and Judson, we spoke on the phone a little bit about what his expertise is as a urologist. And I have just been nothing but excited to bring him on the show because we're going to be talking about something that I get asked all the time. How do I address erectile dysfunction? What does that look like? Do I have it? Do I not? And how do I manage it as I start getting older? And this is what we're going to be getting into today. Tell me a little bit about yourself, Judson. Like, how did you get into this? Every time I've talked to you, it's been nothing but passion for the science that you've been researching.
Yeah, it's really amazing stuff. So I'm a general urologist. So I'm board certified general urology. I went to undergraduate at Brown University, medical school at Vanderbilt. I did research at Harvard Medical School under a Howard Hughes Foundation grant. I went to residency at UCLA, and I started out by practicing general urology. Mm-hmm. So kidneys, prostates, bladders, kidney stones, all that kind of stuff.
Oh, that's all of it, huh?
Yeah, but I'm kind of a technology junkie. Oh. I love to be the first person on the block to do new stuff. So when the Da Vinci surgical robot came out in 2001, we had the second robot in the country.
Wow.
And I was doing robotic surgery long before most of the universities were doing it. And then when lasers came out for prostates and MRIs came out for diagnosing prostate cancer, I was always one of the first ones in the country to do those kind of things. And so then I heard about shockwave therapy for erectile dysfunction, GAINSWave. And I said, if GAINSWave actually produces the results that they're talking about producing, I need to be the first on the block to do it. And so I went to Florida to the GAINSWave Institute. I trained there. I learned the techniques of GAINSWave, and I brought it back to Northern California, and I started treating my patients. And I wasn't quite sure it was actually going to work. I was very skeptical. But after treating 20 or 30 patients, I said, wow, this is really interesting. This GAINSWave is actually working to improve sexual function in my patients. And so I called up my attorney. My attorney is like the most skeptical. if it's going to work on him, it's going to work on anyone. And believe it or not, it actually, my attorney after the 5th or 6th treatment turned to me and said, you know what? Placebos never work on me. And this stuff is actually working. And so then I realized I was onto something. And so I then really became interested in the why. Like my practice is up in Northern California, Brandeis MD. So I'm in San Ramon, California, which is kind of equidistant between Silicon Valley, Napa, San Francisco. It's really right at the hub of a whole bunch of really smart people. So I have patients from Apple, Google, Facebook, Lawrence Livermore Labs, Oracle.
Wow.
And all my patients are why patients. So sometimes people go to the doctor and they say, yes, doc, whatever you say, doc, I'll do that, doc. My patients, they come in with a stack of papers from the internet. And they say, explain to me how this works, why this works. And so I got into the habit a long time ago of getting really good at explaining why stuff works to patients. And what I find is that when you explain why something works to patients, then you get a patient advocate. You get a partner as a patient, as opposed to someone who's going to blindly follow you. And when you have a partner who understands why something works, they're much more likely to follow your clinical recommendations. And on top of that, when they're really intelligent patients, they'll ask really good questions, or they'll come to you with some stuff that some research that they've done. And I'm very open to learning from my patients. And
very research oriented.
Yeah. I mean, one of my patients came up to me and said, tell me about this P shot.
I'm actually very interested in that. I think we're getting into the second episode.
Yeah,
we're gonna
I don't know what a P shot is, but you know what? I'll find out about it and I'll tell you about it. And so it's been an amazing journey for me. And actually, I've become very passionate about men's sexual health and men's male rejuvenation.
Oh, okay. So you've been on male rejuvenation, and that's kind of what this GAINSWave is supposed to help with. Is that right?
Exactly. Well, I mean, the thing is, I've discovered the 3 pillars of manhood.
3 pillars of manhood. I'm all over numbers and manhood.
Yeah.
Tell me about that.
Yeah. Okay. Guys want 3 things. They want to feel good, they want to look good, and they want to have great sex.
Can't say I'm going to argue with that.
Yeah, and I've run that by hundreds and hundreds of men, and almost 100% of them say, just kind of shake their head and say, yeah, you got it. And so most men don't want to pursue physical intimacy if they don't feel good and they don't feel like they look good. So I started really by pursuing erections, but in pursuing erections for my patients, I also had to keep in mind that there's a psychology of this and there's a physiology of this. So you have to get guys in the right mind frame, and you have to get them feeling good about themselves, self-confidence, self-worth. And in that situation, they're in the right place so that when you improve blood flow to the penis, which is, I'm a world expert in improving blood flow to the penis. That's the super subspecialty that I've kind of pigeoned myself into. And so, when you get a good rigid erection, you need to be in the right mind frame to want to use it.
Gotcha. So it's not just about how much blood flow can we get to the penis. It is, where's my self-confidence? How am I thinking about myself? Do I think this is going to work? Am I anxious? Am I distressed? Am I depressed? Am I not in an okay place? Are one of these 3 pillars not working?
Yeah. And am I connecting with my partner?
And am I connecting with my partner? I think that is, if I were to add anything to the 3 that you put there, is I want to feel desired. I want to feel connected. I want to be with my partner, not just have sex.
Absolutely. Well, the men that I see in my office, and we see, dozens and dozens of them every week, for the most part, they're men in their late 40s or older, and they're hardworking, and they have families, and they give to their families, they give to their job, they give to their community, and they're sapped.
Mm-hmm.
They're strong people, but you reach a point in life where you begin to run out of energy, the mojo that kind of kept you going. And when we look at it, their testosterone's low, their muscle function isn't as good as it used to be. They're not in shape like they used to be. They're slightly overweight, and they're losing sexual interest, they're losing sexual function. And at a certain point in your life, it's kind of a late midlife crisis. You have to kind of turn the ship around.
Mm-hmm.
And we really empower men to feel like it's not only is it okay, but you need to do that. You need to do that for yourself, and you can't help other people if you can't help yourself.
So starting off with helping yourself. One of the things that I think is important for us to do as well is what are some of the reasons why erectile dysfunction even comes about? What are some of the things that you see? We were saying testosterone. What else comes up?
Right. So part of living in the United States is your diet is not that great. People eat fast food, they eat donuts, they have soda. Diabetes is rampant. Diabetes really adversely affects erectile function.
Mm-hmm.
Coronary artery disease or vascular disease, so disease of the blood vessels, because really erectile function is a vascular disease. It's the ability to push blood flow into the penis to the point where you can get a rigid erection. And we can talk about that in just a minute.
Mm-hmm.
But when you think about it, when the heart pumps, the first place blood goes is back to the heart through the coronary arteries. And the coronary arteries are about 3 to 4 millimeters wide.
Mm-hmm.
The next place the blood flow goes is to the brain, and then the lungs, then the liver, then the kidneys, then the intestines, and then the blood flow splits right at the level of your belly button into a left and a right branch.
Oh.
And then that splits again into the branch that goes to your leg called the femoral artery, and the branch that goes to your pelvis called the hypogastric. And the hypogastric has a number of branches. So it goes to the gluteus or buttock muscle, it goes to the tailbone, goes to the bladder, goes to the prostate, goes to the rectum, goes to the vas deferens, and the very last branch of the last major artery of your body goes to the penis.
No kidding.
So the thing that guys think about the most is the last thing that gets blood flow.
It's the last
kind
place.
Of ironic. Yeah. I was giving a talk at a men's club the other day, and this guy, he puts his hand over his heart and says, "How come God didn't put the penis right here?"
right in the chest.
Right in the chest.
Could you imagine? Well, yeah, we probably shouldn't imagine, but
yeah.
So that is fascinating that the blood flow goes last to the penis.
That's the last place it goes, and the arteries that go to the penis are 1 or 2 millimeters.
Oh, okay.
So the arteries that go to the heart are 3 to 4 millimeters.
Mm-hmm.
And so because of that, you're much more likely to occlude blood flow to the penis before you occlude your coronary arteries. Mm-hmm. So it's kind of like a canary in a coal mine.
Gotcha.
Right? When they do studies and look at the development of erectile dysfunction, within 7 years, 15% of those men will have some sort of major cardiac event.
Wow.
So if you're younger and you have a family history of some heart disease and all of a sudden you're not getting erections like you used to, it certainly makes sense to go to your primary care doctor or even a cardiologist, get a stress test, get some sort of evaluation, get your cholesterol checked, because it's an early warning sign that things aren't working the way that they should be.
Wow, I like how you word it.
If anyone, if your listeners get one thing from this podcast, that would be the most important thing, is that erectile dysfunction is an early warning sign for other vascular disease in your body.
Wow.
So within 7 years, 1 out of 6 guys has a stroke or a heart attack or some other major vascular event that you could prevent by going to the doctor, getting on a cholesterol medication or a blood pressure medication or whatever you need.
Wonderful. That is news to me. I really like that you brought that up. I'm also curious. So I think one of the first things that people go to when they are looking at, I've lost my erection, or it's not as the way it was before. Put me on that blue pill. Time for some Viagra, Cialis, or another long word 5. What is it?
PDE5.
PDE5.
Yeah.
Tell me, how come that is not a solve-all for erectile dysfunction?
Right. So, like most systems, a lot of my patients are engineers, so I like explaining things in terms of systems.
Okay.
Okay. You have a signal and you have a tube or a pump.
Mm-hmm.
Okay. So the signal for erectile dysfunction is mediated through a molecule called nitric oxide. Okay. So you have a nerve, and that nerve releases nitric oxide onto a blood vessel, and the blood vessel opens up.
Mm-hmm.
Okay. But it's a little bit more complicated than that.
Oh, I'm sure it is.
Nitric oxide is responsible for moving blood flow everywhere throughout your body. So in men, in women, in all mammals, so dogs, cats, giraffes, rhinoceroses, everyone uses nitric oxide. It's one of the most important molecules and neurotransmitters in the body. Okay. Now you have a system in your body also called the phosphodiesterase system. And nitric oxide and phosphodiesterase are responsible for opening and closing blood vessels. So think about it this way, right? You go work out, you need blood in your legs and your arms.
Mm-hmm.
After you work out, you go get some food, you need blood flow to go to your intestines. After you eat, you go and you read some books and prepare for the next day, you need blood flow in your brain. How is that accomplished? Nitric oxide is constantly being excreted from nerves, opening up blood vessels, and phosphodiesterase is breaking things down and closing these blood vessels. Now, the genius of Viagra was that there are different phosphodiesterase systems throughout your body.
Oh.
As opposed to nitric oxide, which is everywhere, phosphodiesterase number 5 lives in the penis.
No kidding.
So
I'm loving this. I've never had it explained in the way that you're talking about it right now.
Yeah. So when they were testing sildenafil, which is generic Viagra, they had 100 patients. They were testing it as a heart medication because it's a vasodilator. It opens up blood vessels. In fact, it's used in primary pulmonary hypertension where the blood vessels going to the lungs are blocked.
Mm-hmm.
So they gave it to 200 people. 100 people they gave the Viagra, and 100 people they gave the placebo. And at the end of the study, they sent a letter to everyone and said, please turn in your medication. So everyone that had the placebo sent their medication back, and everyone that had the Viagra, nobody sent their medication back. They were like, come on, guys, send it back. And they said, no, we're going to keep it. And so when they finally did some investigating, they found out that, lo and behold, it improved erectile function in these patients.
Wow.
And so that's how they figured out that Viagra worked. And then they drilled down on exactly what it was. And they found it was a phosphodiesterase number 5 inhibitor.
Mm-hmm.
Right. So some people get a little bluish haze in their eyes when they take Viagra. There's phosphodiesterase number 6 in the eyes.
Oh.
And so there's a little bit of cross-reactivity between 5 and 6. And that's where a lot of the side effects of the PDE5 inhibitors come from. Is you'll get facial flushing, you'll get headache. Some people get reflux, some people get stuffy nose.
Mm.
It comes from a vasodilation of the PDE5 system.
Okay.
Yeah. But just taking a pill to block PDE5 is a temporary solution to a problem.
Okay.
And as you get older, you lose nitric oxide. So nitric oxide is that super important molecule that serves as a neurotransmitter that allows arteries to communicate with nerves, or nerves to communicate with arteries.
Mm-hmm.
By the time you've turned 50, most Americans will have lost 50% of their endogenous production of nitric oxide, the nitric oxide that you make on your own.
Okay.
And by the time you turn 70, you've lost about 75% of it.
So
you can still function
mm-hmm.
with 25% of your endogenous nitric oxide production, but you're not going to function at the same level that you did before. You're going to function like someone who's 75.
Gotcha. So this is where that I've always been wondering, because I work with a lot of men, and as they reach the age of 42 or 48, there's this looming, I'm going to turn 50 and lose my erection. Like that's a common misconception I hear, is that, well, after 50, I'm done having sex because the penis just essentially might as well just fall off.
Yeah, well, it's not really a misconception. So if there was something called the Massachusetts Male Aging Study. So it's a huge longitudinal study of men in Massachusetts, tens of thousands of men. And what they found was men in their 40s in Massachusetts, 40% of the time will have some degree of erectile dysfunction. In their 50s, 50%. In their 60s, 60%. So if you look at men over the age of 50, at least 50% of them will have some degree of erectile dysfunction.
Gotcha.
Okay, but that doesn't mean that they have to. It means that they're not doing the things that could prevent erectile dysfunction.
Okay. And does that kind of get into these, because you've talked about, or you were talking to me about the biohacking for the aging penis. You've got like 5 steps on addressing this issue. Is that right?
Absolutely. Yeah. I mean, that's one of the best parts of life. I mean, do you really want to lose that?
No.
I mean, most guys would like to hang on to that as long as they possibly can. Yeah. And so 5-10 years ago, if you read, Men's Health magazine or one of these health magazines, they would run articles about how to improve erectile function. And it would talk about all the things that are heart healthy, and none of them are wrong. So, eating well, exercising. And when you talk about exercising, the studies that have been done on exercise and erectile function will tell you that you need 40 minutes of moderate to vigorous cardio 4 times a week.
Holy cow. That's not a lot of what people are getting right now.
No. So when you talk about exercise is, a short word, but you need to know exactly how much exercise. So that's how much exercise. And that's also the heart healthy exercise. In terms of eating better, a lot of the fruits and vegetables that are different colors have flavonoids, and flavonoids are very heart healthy and good for improving erectile function.
Oh, okay.
So exercise, eating well, don't drink, don't smoke. What else? All the basic things. Reduce stress. I mean, if there is such a thing as reducing stress in this world.
Yeah.
Okay. But beyond that, I have 5 things that you can do that are fairly simple that will improve erectile function, that aren't the intuitively obvious things that we all kind of know and choose to do or not do on a somewhat selective basis. Okay. And the first is to take a nitric oxide booster. Okay. Nitric oxide boosters are a supplement. So I make a supplement called Affirm. It's available at affirmscience.com. And there are a number of other nitric oxide boosting supplements. Affirm is L-citrulline, which comes from watermelon. The amazing thing is the minimum dose of L-citrulline that you need to take to be effective is 3 grams. The maximum dose is 10 grams. That equivalent is about 3 to 10 pounds of watermelon that you have to eat a day.
That's a lot of watermelon.
Yeah. I just read an article about that the other day. I was cracking up. I just had this vision of somebody eating 3 to 10 pounds of watermelon every day.
Holy cow. And that's just to get to the minimum, or that's to get within that?
The minimum is 3 grams. The maximum is 10 grams.
Oh, okay.
And so a lot of people take arginine, which biochemically sounds like a good idea, but it's actually the wrong thing to take. Arginine gets broken down by the liver, and it doesn't get into the system, and it actually artificially drops your blood pressure. So what happens is if you take L-citrulline is converted in the kidney into L-arginine. L-arginine is the nitric oxide donor that causes dilation of blood vessels. So you need about 3 grams of L-citrulline. Affirm also has beets. Beets are a food that's very high in nitric oxide. And then also it has Muripoama, which is Brazilian potency wood, which is also high in nitric oxide. And then it has ginseng. And in ginseng, there's a wealth of information about ginseng as a nitric oxide booster.
Oh, okay. So those boost nitric oxide in the body, and that's all
Exactly.
in the pill that you, or in this the supplement that you have or that you make at affirmscience.com. That's where you could get something like that, so you don't have to eat 10 pounds of watermelon
10 pounds
a
of
day.
watermelon. Exactly. So, nitric oxide boosting improves athletic performance. A lot of elite endurance athletes take nitric oxide boosters. In studies, they improve athletic performance about 2 or 3%, which doesn't sound like a lot, but when you're an elite athlete competing against other elite athletes, 2 or 3% is actually a big deal.
Yeah.
It improves cognition. I've had patients who are diabetics that tell me that they take less insulin. And it's not because of that nitric oxide affects the sugar, it affects the blood flow to the pancreas. And the pancreas now is working more effectively.
Okay.
I've had patients tell me that their neuropathy gets better. It's not because it's doing anything for the nerves, it's improving distal circulation. So it improves circulation to the nerves.
Okay.
So
because we're all looking at the circulation. This is all the vascular.
Exactly. The other thing is by vasodilating, by opening up blood vessels, it naturally decreases your blood pressure. See, what happens is as you get older and you lose nitric oxide, you lose the elasticity of blood vessels.
Okay.
So if you think about it, your heart's a pump, right?
Yeah.
If you lined up all your blood vessels, and I don't know who's done that, but this is the number that keeps popping up over and over again, 60,000 miles of blood vessels in your body.
60,000? 60,000.
Yeah, look it up.
Wow.
I guarantee you come up with that number.
Wow.
It circles the globe twice. So you think about a pump that you could hold in your hand, pumping fluid 60,000 miles. It's impossible. So the way that you're built is you have blood vessels that have muscles in the walls of the blood vessels, right? So when the heart pumps, the blood pumps into the artery stretches, and then it contracts. That's why you have a systolic and a diastolic blood pressure. When the artery stretches, it's the systolic blood pressure. When the artery contracts and pumps, it's a diastolic blood pressure.
Wow.
And that's how the blood gets pumped around the body. But if you lose nitric oxide and you have a high cholesterol diet, the arteries get stiff.
Okay.
Right? And when the arteries get stiff, they instead of a dynamic, stretchy system, they become PVC pipes.
Oh, then they're just letting it go through versus pumping it through.
Exactly. And so what does the heart have to do? It has to work harder. When the heart works harder to pump blood through stiff arteries, what do we call that? High blood pressure.
Okay. This is making a ton of sense. Yeah.
Right. So then you go to your doctor and he takes your blood pressure and it's 150 over 100. And what does he say? Oh, you got high blood pressure. What do we need to do?
Put you on a blood pressure pill.
On blood pressure medication. What does that do? It decreases peripheral circulation. What does that do?
Causes erectiles to go down.
Exactly. So it's a kind of a circling down the drain, because then what happens? Then you don't get erections for a while. And the most important erections men get are the ones you get at night.
Okay.
So when you're younger, you get anywhere from 30 to 60 minutes of erections every night. Just when you can hit into REM sleep, and it's part of this house cleaning that your body does at night. And so the lining of the inside of the penis is made of collagen and elastin, the same stuff that your tendons and your joints and your ligaments are made of. If you don't get erections at night, two things happen. One, you don't get oxygenated blood in the spongy tissue on the inside of the penis.
Okay.
And because of that, you get fibrosis.
So you get fibrosis in the corpus cavernosum, like
exactly
that spongy stuff.
On the spongy tissue.
The spongy tissue.
If you don't stretch your hamstrings for 6 months, what happens to your hamstrings?
Gosh, it tight as all get out.
Right. So if you don't stretch your penis for 6 months, what happens?
It gets tight.
So then when you have an opportunity to get an erection, what happens? You start to pump blood into the penis, but the corpora, the tunica lining the corpora, gets really stiff. And it becomes even more difficult to stretch that.
Okay.
And then the spongy tissue is fibrotic. So if you ever wash the car and you leave a sponge out in the sun for a couple of days, the sponge gets really compressed.
Yeah.
Sponges work because there's space in the sponge. And if they're compressed, you have to push blood really hard to get into the sponge to open up those compressed spaces.
And we're working at the end of the line of the blood.
Exactly. And if you're already in a situation where your blood flow is compromised, then you're not going to get, instead of maybe 100 millimeters of mercury needed to get an erection before, now you're at 125 or 150 millimeters of mercury. And so all the Viagra in the world isn't going to help you get an erection at that point.
Gotcha.
So it's one of those things there. If you want to maintain good erectile function, it makes sense to start early. And starting early means a nitric oxide booster. It also means taking PDE5 inhibitors like Viagra or Cialis. Viagra and Cialis turned generic.
Yeah.
And so they're very inexpensive. In my office, we sell them for $1 a pill.
Wow.
And so if you're a man and you're starting to have erectile dysfunction, you can take generic Cialis, 5 milligrams a day. It costs less than a cup of coffee. And it will help restore those nighttime erections that keep that tissue stretching.
Okay.
And there's also an FDA indication for generic Viagra for improving urination.
Oh, really? What's that
so
called?
It's called tadalafil, which is generic
tadalafil.
Viagra.
Gotcha. Yeah.
And so my patients use generic Viagra fairly liberally because at a low dose, there's very little side effects.
Okay. The other thing I think of when it comes to, if we're going to bring the mind into this on my side of things, where Viagra, I've worked with individuals that take Viagra, but were experiencing high levels of anxiety or experiencing a lot of depression, a huge change in life, and those also affect erections. And so as it can be medical, it can also be mental. And so check in with your doctor, check in with the urologist, because those are, it's important to see where you're at in life, especially with what you're talking about.
That's one of the things that I love about what I do is it's not just, you're not just affecting a physical process, but it's an emotional and a psychological process. You have to have someone in a parasympathetic state of mind. If they're in a sympathetic or an anxious state of mind or a stressed state of mind, you're never going to, you can do everything you know how to do. Patients aren't going to get an erection because in a sympathetic state. So for the way I explain sympathetic and parasympathetic is with a caveman.
Okay.
So say you're a caveman back in the day and you're in your cave with your cave woman and there's a saber-toothed tiger prowling outside your den, right? You're going to have massive amounts of adrenaline.
Oh, yeah.
Because you need to attack or defend against the saber-toothed tiger. And it's really not a good time to get an erection. You imagine charging out of a cave with an erection. It gives the tiger something really good to bite on. Okay, so now the tiger's just not going away. It's been 2 or 3 days. Your cave woman's looking at you, and she's starting to give you that evil eye. You're starting to get hungry, right? If you're married, you've been there before. And then she starts, it's day 4. She's getting really hungry and irritated. And she's like, you are just the biggest wimp. Why don't you go out there and kick the tiger's butt? What's wrong with you? And then it's day 5. And she's like, you're just a wuss. I'm getting hungry. You got to do something. Day 6, you pick up a spear and you say, I would rather take my chances with the saber-toothed tiger than spend one more day in this cave with my cave woman. And so you charge out of the cave, you stab the saber-toothed tiger, you kill the saber-toothed tiger, you get this massive surge of adrenaline, and then the saber-toothed tiger's down and your adrenaline goes down. Okay, so now you go from a sympathetic state to a parasympathetic state. So you drag the saber-toothed tiger back into the cave, you skin the saber-toothed tiger, you have the tiger meat on the spit, you got the tiger rug, and your cave woman's, like, my hero, she's all fired up. And you go from a sympathetic to a parasympathetic. Now, as parasympathetic, you get blood flow to the intestines, you get blood flow to the kidney, and you get blood flow to the penis.
Okay.
For the purposes of reproduction. Okay, so then, you're making love to your cave woman, you reach climax, you ejaculate. Ejaculation is a sympathetic function. So you get a surge of adrenaline, you get ejaculation, and the erection goes away. Now, why does that happen? Well, think about it. If you're a squirrel and you're copulating in the field, you don't have the luxury of relaxing in bed afterwards and smoking a cigarette. Because as soon as you're done copulating, you're going to have a hawk circling around looking for a squirrel that's not moving.
Yep.
And so it doesn't really matter if you've reproduced if you're a dead squirrel. And so ejaculation is a sympathetic function. It makes the arteries in the penis constrict, and you're done with your business, and you have to turn around and start defending yourself again.
And that's where we enter the refractory period. That's what that is for. Okay.
Exactly. And so that's how evolutionary biology created reproduction.
Oh, that is fascinating. So we've got this step one where we're looking at the nitric oxide booster, and then step two. Have we been talking about step two, or?
Well, step two is the PD5 inhibitor.
Oh, step two is the PD5 inhibitor.
Yeah.
Okay.
And those two work together to improve the signal. Now, the other part of this is the pipes. If you turn the light on, but the light bulb doesn't work, it's not going to work. You need the pipes to pump the blood. Okay. And as men age, they lose nitric oxide, they clog their blood vessels. And so you need to increase the blood flow to the penis.
Okay.
The way that you do increase the blood flow to the penis is by using GAINSWave.
Okay.
Okay. So in World War II, they discovered what shock waves were. When they were trying to blow up submarines, the men on the submarines were getting massive internal injuries from these explosions, and it wasn't from shrapnel, it was from the pressure wave or the shock wave from the explosion. And so we use these same shock waves when we want to break up kidney stones.
Okay, I've heard of that.
Actually, you can bring the energy of these shock waves down and use it to stimulate the growth of new blood vessels. So what you're actually doing when you aim these shock waves at the blood vessels in the penis is tricking the blood vessels into thinking that they're being traumatized.
Holy cow.
And when your body is traumatized, you get an inflammatory reaction. And an inflammatory reaction is a healing reaction. And part of healing is growing new blood vessels.
Wow. And so that's the whole premise of the GAINSWave, is to trick the blood vessels into experiencing a trauma, having inflammation creating and stimulating more blood flow, or more vein. Did you say blood vessel growth?
Yeah, arterial growth.
Arterial growth. Wow.
Right. So they did, there's a lab at UCSF. They did a lot of this research on rats. So, it'd be a hard experiment to do on humans. Let me give you shockwave therapy, and then I'm going to cut your penis off.
Like consent to that.
Yeah. So these poor rats in San Francisco at UCSF had shockwave therapy or acoustic wave therapy, and then had their penises removed. And what they saw, so if you're ever in San Francisco and you see a bunch of dickless rats, you know that they participated in that experiment.
I hope they were compensated.
Yeah. What they found was an upregulation of stem cells and an upregulation of vascular growth factors and an upregulation of nerve growth factors. And so that's basically our understanding of how GAINSWave works, is by upregulating stem cells and vascular growth factors, which cause the growth of new blood vessels, causing collateral circulation.
Wow. Man, that's fascinating.
Yeah. And so it's amazing. 6 to 12 sessions, each lasting about 20 minutes, that are totally not painful or not uncomfortable, will improve blood flow enough to get like a 55-year-old guy who's on Viagra, to get him off Viagra.
Holy cow.
Or a 65-year-old guy where Viagra is not working well anymore, it'll get him to the point where Viagra is actually working well.
So you can up step wherever you're at.
Exactly. It's not going to make a 70-year-old guy 18 again. You have to wait for reincarnation for that one.
Yeah, you got to come back.
But it is enough to get guys back in the game.
Okay. And
it's really, that's one of the things that I love about what I do is it's so rewarding when men who haven't been physically intimate and haven't had that connection with their partner now all of a sudden come into the office and they have that kind of rosy glow and that kind of goofy grin that every guy gets when he gets back in the game.
Mm-hmm.
And you know, you're not giving someone life. I mean, when I was doing cancer surgery and treating infected kidney stones, we were saving people's lives, but we're giving guys something to live for, giving them a reason to live.
Mm. And being in that, I think that it's great that we're able to give some ways to go if you're starting to experience erectile dysfunction or you've been experiencing it for a long time. I think it's also important to note that there are, having an erection is an important part for a lot of individuals. That this is an important part in their intimacy and their sexual experiences. And I also encourage everybody to also explore what other ways to experience sexual satisfaction. So it's not solely based around penile function. So as you're getting support, you're working on these, or you're doing 6 sessions with GAINSWave, or you're doing these other things and working on erectile dysfunction, like find out other ways that you're also experiencing sexual satisfaction. So it's not solely based on, if I get an erection, I pass. If I lose an erection, I fail, because that tends to mess with, am I going to succeed this time? And if we get that stress, we're going to move right back into that sympathetic space. And
yeah, I couldn't agree with you more.
Yeah.
You hit the nail on the head. I mean, physical intimacy isn't just about penetration.
Yeah.
It's about emotional connection, mental connection, physical connection. And then, some of my patients who have the best sort of sex life don't get erections.
Yeah.
But they found other ways to physically connect with their spouse. And they come to me and they talk about penetration. And I say, that's a part of it. It sounds like what you have is really good. If you want to pursue improving the blood flow so that you can have that part of physical intimacy, I'm happy to do it with you. But it sounds like you're doing pretty well.
Yes, I love that you share that. Love that you share that, because that is so true, especially as we get into older adult life, that things don't end just when penetration ends. That is one one aspect of being able to enjoy sexual experiences. It is not the only thing.
Absolutely. And the things like, I have a lot of patients who've had prostate cancer surgery, even when they're young, and they totally lose, because the nerves get cut, they totally lose the ability to get an erection. But they can still have satisfying sexual encounters with their partners. It's just different.
Yeah, just different. So as we're looking at GAINSWave, moving into step 4, or this 4th pillar.
Step 4. So step 4 tends to be for guys when they begin to lose that nighttime erection.
Okay.
Right? That nighttime erection is really critically important for stretching out the collagen and the elastin of the penis and keeping that spongy tissue from getting fibrotic. And so there are penile stretching devices or vacuum erection devices that men can use to stretch the penis, because you can't stretch the penis like you can stretch your hamstrings. I read a great quote the other day. I forget who it was, but they said, a great actor can fake everything except for an erection.
That's funny.
Yeah. And so, at night, if you're not getting erections anymore, your penis is going to shrink. It's going to get shorter, and it's going to be more and more difficult for you to get enough blood flow pumping into the penis. What happens is, when you get a certain amount of blood flow, say 100 millimeters of mercury pressure, what happens is it creates a tourniquet effect, and it blocks the return of blood through the veins. And that's when you go from a full erection to a rigid erection.
Okay.
And so you have to be able to get to that pressure. And if your penis is stiff and it's fibrotic, that pressure is going to get higher and higher. And so you're going to have to be able to generate more and more pressure. And if you can't generate much pressure to begin with, it's going to be the end of the game.
Gotcha.
And by using a penile stretching device, what you can do is increase the flexibility of the penis and prevent the fibrosis that a lot of men get when they lose those nighttime erections.
Okay.
And so what I have patients on what are called the 2x4 protocol. So most guys can remember a 2x4.
Mm-hmm.
And so for some men, either diabetics or men who've had prostate cancer surgery that lose the ability to get an erection, you can actually use a penile pump to get enough blood into the penis and put a ring around the base of the penis. Mm-hmm. And so that's one way you can have penetrative intercourse. But if you don't want to do that, you can just basically stretch the penis to keep that elasticity, keep the length of the penis, and keep the inside of the penis from becoming fibrotic.
Okay. So when you say 2x4 experience, tell me a little bit more about the 2x4.
So 2x4 just means twice a day.
Twice a day.
So morning and night.
Uh-huh.
And then what you'll do is you stretch the penis out using the vacuum pump.
Yeah.
Hold it for a minute and then release it. And then stretch it again, hold it for a minute, release it. And if you do that 4 or 5 times, twice a day, you'll be able to maintain penile length and penile flexibility.
Gotcha. I was hoping that you weren't going to end up saying, like, then you get what?
Yeah,
2x4.
That's a good one. Yeah.
Like maybe
or you're as rigid as a 2x4.
You'll be as rigid as I had to. Well, we're talking about penis erections. We got to.
Well, the thing is, a lot of my patients are contractors.
Oh my goodness.
Yeah, so you got to give them something they can relate to. I could do a 3x5 protocol, but they're less likely to remember. If you tell them 2x4 and 4, I have a 4x4 protocol too.
Oh, that makes sense. Yeah, what you're building houses with.
Exactly.
So you use a penile stretching device. Do you have any recommendations of where someone would be able to get that? Is that something you can just look up online?
So you can get it online. If you're going to put something on your penis, I would make sure that it's actually medical grade. So the ones that I use are from a company called Gesiva, GESIVA.com. And they're good because they have a lockout valve in terms of pressure, so you can't over-pressurize the penis. If a cheap pump, you can actually pump too much and cause some capillary damage.
Yeah. Ooh.
And I've seen guys whose penises look like eggplants, so it's...
Yeah, we don't want that.
That's a real thing. If you're going to put something on your penis and pump it up, you want to make sure that it's good quality.
Okay. And so they'll have regulating gauges so that you're not doing that. Okay.
Exactly.
And this Gesiva does that. Or at least they're okay. Cool.
Right.
All right, on to the fifth one.
That's the fifth one.
Yeah.
So the fifth one is an interesting one. It's called platelet-rich plasma.
Okay.
Or the P-shot. So some people have heard of the P-shot or the O-shot. So the P-shot is named by Charles Runnels, who's a doctor down in Alabama, who's a very clever marketing guy. And he marketed the Priapus shot. Priapus is the Greek god of erections.
Mm-hmm. Oh.
Yeah. I don't know if you've ever been to Pompeii.
Not been there, but...
So I don't know if you know much about Pompeii, but Pompeii was kind of like the Club Med of ancient Rome.
Okay.
And when I think it's called Krakatoa, Vesuvius exploded and covered Pompeii in ash, time stood still. But then when the archaeologists came and started digging it out, what they found, in addition to all these frozen people, were tons and tons of statues of Priapus.
Oh.
Which is a Greek god with a big erection. Mm-hmm. And so the Pope got really pissed off, and the Pope demanded that all the statues being taken to the basement of the Naples Museum.
Okay.
So if you want to see something really interesting, when you go to Pompeii, visit the basement of the Naples Museum, you'll see a lot of erotic ancient statues.
Wow, that's fascinating.
So, but anyway, that's a little diversion. Dr. Runnels named this shot the Priapus shot. Mm-hmm. Okay, so what PRP? PRP stands for platelet-rich plasma. And most people know platelets to be what causes clots.
Okay.
But platelets have actually 2 functions. So think about it. You're out mountain biking and you crash into a tree and you cut your leg. Mm-hmm. Okay, what happens? The first thing that happens is that you start bleeding. Mm-hmm. And platelets get called to the area that is bleeding by what are called inflammatory cytokines. So signals sent out by these cells that are injured that attract platelets. Platelets go there, and platelets are round. So if you think about it, like a whole bunch of marbles are going to this area of bleeding, it's hard to think that a whole bunch of marbles could form a clot. But what happens is a lot of calcium gets released, and calcium causes activation of platelets. And when platelets are activated, they stick their arms out and they grab onto other platelets. And they form this web that catches a bunch of thrombin and other stuff, and it forms a clot.
Okay.
Now, when platelets open up their arms, they release growth factors.
Okay. So we're stimulating growth.
Exactly. The next thing that happens is white blood cells come in and they kill bacteria and they eat up a bunch of this devitalized tissue. The next thing that happens is proliferation, and the next thing that happens is remodeling. So the skin gets smooth again, right? But all of it is mediated by the platelets because the platelets release growth factors. So if you ever wonder why, when you cut yourself, that area of skin grows quickly and the rest of the skin stays the same, it's because of the growth factors released by platelets.
Okay.
And so people or physicians take advantage of this. So if you draw blood and you spin the blood down, when you spin the blood down, the red blood cells have iron in them because iron bonds to oxygen. So the red blood cells go to the bottom. Plasma, which is basically the water that your blood cells float in, goes to the top, and the platelets and the white blood cells go in the middle. And so you can actually harvest and resuspend the platelets and the white blood cells and then inject them in different places. So, for example, in orthopedics, they use it for a partially torn shoulder joint or a partially torn knee. You can inject PRP, which accelerates the growth and the healing of the knee or the shoulder. In hair growth, you can actually inject PRP into the scalp, and it accelerates the growth of hair. And in the urology space, you can actually inject PRP into the penis. And there's some evidence, initial evidence anyway, that it increases the growth of blood vessels and penile tissue.
Okay. So it's still kind of at the cutting edge of the research.
It is so the data on orthopedics is pretty robust. The data on hair growth is pretty robust. The data in urology is kind of lagging.
Gotcha.
So although I have 3 IRB approved studies that I run out of my office, one is called the SWEET study, which is the Shockwave Erectile Enhancement Trial. And so I have 50 offices around the country that are all sending me data to figure out the best way to utilize GAINSWave.
Nice. Because
we know that it works in certain patient populations, but we don't know what the best protocols are. We don't know what the best machines are. And so my job as the director of clinical excellence for GAINSWave and as a physician and a researcher is to determine how to best serve my patients and what the best patient protocols are, because you can't treat a 55-year-old with mild ED the same way that you treat a 75-year-old diabetic who smokes and is on a beta blocker.
Oh, that makes sense.
So what I'm trying to do is develop patient-specific protocols, and we're doing that through the SWEET study because we're trying to get as many patients as we possibly can. Within, I think, the first 6 weeks, we've already recruited 80 patients.
Great.
From around North America. My goal is to get 2,000 or 3,000 patients in the database, and then we can really begin to drill down on how to treat diabetics versus non-diabetics, or 50-year-olds versus 70-year-olds.
Great. Wonderful. I'm glad you're doing that. You're doing that.
One of the other studies that I'm running is called PLONG.
Okay.
Which is a penile elongation study. And we're using PRP and a variety of penile stretching techniques to safely elongate the penis.
And I think we're going to get into that into the next episode as well.
Absolutely. Well, it's a teaser,
It is a teaser. That's what I'm like, and I'm super excited. I have to say that just to remind myself, like, don't ask questions now because there's so much in that.
If you want to hear about how you can elongate your penis safely without surgery, tune into the next podcast.
Yes, into the next one. And so that's the PLONG study.
Exactly.
Gotcha. So as we've been talking about all this, and we're just getting towards the end of our time talking about this, I mean, are there any guaranteed fixes for erectile dysfunction as of right now? Guaranteed fix.
What I would say is the first thing to do are like the 5 or 6 things that you'll find in every health magazine. So eat right, exercise, at least 40 minutes of cardio a week. Don't drink, don't smoke, take good care of yourself.
Okay.
Communicate well with your partner, so you actually have someone to participate with, and take care of yourself mentally and psychologically as well.
Yeah.
Make sure you're not having physical intimacy for the wrong reasons. Then beyond that, to get to the more advanced stuff, a nitric oxide booster like Affirm, a PDE5 inhibitor like daily dose tadalafil, GAINSWave, really important, a vacuum erection device, especially when you get up to 65, 70 years old and you're not getting nighttime erections. And there's some really good evidence that PRP will also help improve this process. PRP is basically just growth factors. It's like putting fertilizer on a little plant or a bush that's growing.
Gotcha. And so as we're doing all these things, these are always, again, it just sounds a lot like making your health a number one priority moving forward with that. But we don't necessarily have, you get to do this and then that'll take care of it as of right now for whatever we have. But we have a lot of ways that we can start exploring and seeing what's going to work best for you.
Absolutely. These are biologic systems. There's a lot of variability. There's genetics that are part of it. When I was treating a lot of patients with kidney stones, I would look at hundreds and hundreds of CAT scans with patients. And we'd look at the kidney stones, but I would also look at the vasculature with the patients, because it's kind of fun to look at kidney stones. And I would say, listen, you have a lot of calcification and atherosclerosis at the bifurcation of your aorta, or your bifurcation of your iliacs. You need to take care of that. You need to go to a cardiologist or a vascular surgeon. And patients would look at me and say, no, I eat really well and I exercise and I do all these, I do everything right. And I would just look at them and say, listen, I'm just reading the tea leaves. Yeah. This is what I see on the inside, regardless of what you're doing. So biologic systems are all variable, but there are certain tried and true things that we all can do to improve our cardiovascular health and also our ability to maintain erections and physical intimacy I had this one guy a couple of weeks ago. He's 91.
Whoa. And
he came in to see me for enlarged prostate. And he kind of leans in at the end of the visit. And he says, I need to ask you something embarrassing. I said, man, at 91, what could possibly be embarrassing? He said, can I get some Viagra samples? I said, if I was 91 and I was asking for Viagra samples, I think I'd put it on a billboard over the highway.
Yeah, definitely.
It's possible to maintain physical intimacy well into your 80s.
Yeah.
If you take good care of yourself.
Very much so. Very much so.
And if, for guys out there, remember that women live a lot longer than men. So for my 85-year-old men who are still active, a lot of women bringing over pies to their house.
Bringing over the pies. Oh man! So as we continue talking about male-bodied health, we're going to get into this next episode where we're going to be talking more about premature ejaculation, penis elongation, diseases of the penis, as well as we're going to touch a little bit on the delayed ejaculation and some of the things that come up for that. So be sure to tune into our next episode because we have so much more information to get out and a lot of other great conversation to have. Thanks so much again, Dr. Brandeis, for being here and talking to me about erectile dysfunctions. This has been very enlightening, and I'm really excited to get into the next topics that we have coming up.
Oh, me too. Thank you for having me, and I look forward to it.
This has been another episode of the Birds and Bees podcast. Thank you for tuning in. If you have any questions about the show, comments, or questions you would like addressed in another episode, please give us a call at 385-449-1818. Leave your voicemail and your question, or you can also email us at birdsandbeespodcast@gmail.com or visit us online at birdsandbeespodcast.com.